region and our wardens all work together to advocate for some strategic priorities, and workforce is one of those priorities we work with the provincial and federal governments on. So it's my pleasure to be here to moderate this absolutely amazingly talented panel this morning. And so my background is economic development, and for time eternal, infrastructure has always been about buildings, roads, and the power to supply the buildings and roads and attracting investment, those buildings, those businesses. But if anything, the Great Resignation and retirement has taught us is that workforce is infrastructure. We need the people to make sure that there is success in those businesses that we're attracting as economic development. So this panel is really going to be talking about and giving their incredible insights as to how we can bridge that gap of workforce development and economic development and all of their amazing insights. So it's my pleasure. I'm going to do a quick intro here of our guest speakers. I'm going to make sure I've got it all right. So we've got Pam Uppal. Pam's in the middle there, and she's the Director of Policy for the Ontario Nonprofit Network. And over the past 10 years, so she started when she was like 9, she is focused on bridging frontline work, research initiatives, and policy advocacy to help build equitable systems. And at the end there is Rania Younes, and she is the Senior Manager for Employer Networks and National Engagement at the Immigrant Employee Council. And she also leads the National Network of Immigrant Employment Council of Canada, which is a collective committed to helping Canadians and Canadian employers attract, hire, train, and retrain retain immigrant talent across Canada. Those were a lot of words altogether. And Fiona Peacefull. Hi, Fiona. Is the Vice President of Human Resources at Niagara Health, and that is a team made up of 7,300 employees, physicians, volunteers, and patient partners who deliver extraordinary care to every person, every time. So we are here to kick off the panel, and we're going to start it off with a great question. So welcome, ladies. My pleasure. What comes to mind when you think of workforce as economic infrastructure as the first part? And what are you seeing in terms of economic benefit or challenges impacted by the current state of our labor market? So Pam?
Sure. It's always nervous being the first one, right? Because I get to set the tone. But I wanted to take the opportunity to sort of talk about the sector, so who we are, what we do, and kind of what we're seeing in terms of labor force challenges, and some partnerships we'd hope to build with those in the room today. I was also furiously taking notes when Mike was speaking, so would love to sort of shed some light on those pieces too. And so as shared, I'm from the Ontario Nonprofit Network. We're an independent membership-based network for about 58,000 nonprofits and charities across the province. And our goal is to create an enabling public policy environment for them. So we don't do direct service delivery ourselves, but advocate on behalf alongside with all the nonprofits and charities in the communities that you come from to make sure they can do the best work that they're doing on the ground. And just to give you a sense, we're sort of forgotten sometimes. Sometimes folks don't know what do we do and what's a nonprofit and what's sort of their contribution. So we're an employer. We have about 850,000 employees across the province, and that number's just growing over the years. 80% of our sector consists of women workers, so we're a women majority workforce, just like nursing, midwives, et cetera. And a third, or even more than that, half are racialized folks in our sector, particularly on the front line. So I'm thinking about your housing workers, your job developers, women's shelters, food banks. A lot of those workers are also racialized folks. We also function like your small business in your communities. So we provide services, we purchase locally usually, and we also drive economic activity. So just to give you a sense of that, we do about 65 billion in economic impact, and this has only increased 43% over the last 10 years. With $1 of investment in our sector, we generate up to $2.18 in GDP impact, $1.76 in employment income impact, and with an output of every $1 million, about 2 jobs We create about 2 jobs. And there's this common misconception that we just get all our money from government and that's it. Actually, government funding really only makes up a small portion of our work. A lot of our funding or our revenues are earned income, they're diversified, a lot of volunteer engagement, donors, private, public, foundations, and we leverage all of that to create this economic sort of contribution to communities. And this doesn't account for all the social benefits of having nonprofits and charities in your communities. And then the other piece started, who are nonprofits? I was actually in a meeting once with the province, and I was with Craft Brewers of Ontario, and everybody could name a craft brewery in their riding or in their constituency. No one could name a nonprofit, and so I wanted to share, even though they might have interacted with them. So I wanted to share, who are we? What do we do? So when I talk about nonprofits, I'm really talking about your community-based organizations. These can be charities as well, they can be grassroots groups, mutual aid networks, but really folks who come together because there's a community need and function for the public benefit. So we have a governance board which comes up from community, all volunteers. We're allowed to engage in earned income revenue generation because everything gets reinvested back into the organization and into communities. We own land, real estate, buildings, and those are public assets in public hands. So even if we want to sell them, it has to go back to community. So they're not private in any way. And just sort of picking up where Mike was talking about, we're first responders as well. A lot of the trends that Mike was talking about, we've been sounding the alarm on in the sector for the last 2 years, actually. All the demographic shifts, all the population changes, who's coming in, who's coming out, we've been seeing for the last 2 years because that means a direct increase in demand for our services when those sort of population shifts happen. So who are we? We make up organizations in your communities that everyone uses, like childcare, elder care, home care, Meals on Wheels, employment and training. We make up services and supports that bring communities to life. So your mini soccer leagues, your arts and theater, your festivals in your communities, your local Rotary clubs, Legion clubs, etc. But we also make up services that folks, when they're not doing well, need or rely on. So housing, affordability, immigration, settlement, gender-based violence services, mental health and addictions, food banks, shelters, etc. And that helps communities, right? Those create safe communities. But what we're seeing is a massive HR crisis in our sector for the last year. Not uncommon, like other industries, just started off with not enough people to work because of all the demographic changes. Also because service increase is going up, demand on our services are going up, partly because nonprofits usually have better outcomes in a lot of these spaces. And because of the population shifts and just not a lot of people who want to work in our sector. And so we've been sort of thinking about why that's happening and where people are going. We're losing a lot of people to the public sector because usually it's the same job and better pay because there's better funding there. We're losing people from big cities because, as Mike was sharing, they're not able to afford spaces. And that's the other thing. Our workforce is one in community. It's sort of not separate. So whatever is happening broadly impacts our workforce as well. And we're just not able to keep up with wages. And that has broader structural pieces to it as well. We do want more people to work in our sector. There's lots of value alignment. Lots of folks want to work in our sector. And I think this group is an interesting space to sort of talk about that.
Great, thanks, Pam. And so really, you're representing the groups that are that quality of life piece, right?
Yeah.
That offer that sticky factor for those 30s and 30-month-olds.
Yeah, so the childcare workers, that's all nonprofit driven. I think folks are talking about not just young families, but elder care, so personal support workers, long-term care centers, home care, all of that is nonprofit driven. Parks and recreation, all nonprofit or municipal driven. Also like recreation, sort of like swimming classes and your library, those are all nonprofit driven. And unfortunately, given the state of how things are, we are seeing closures. Like lots of communities are losing that. So as you were sharing, like physical infrastructure is booming, but social infrastructure is not keeping up, and that's something that we play a big role in.
Great, thanks so much, Pam. Rania.
That was a lot. No, but actually it just kind of inspires when you say workforces and economic infrastructure. For me, what comes to mind is that interconnectedness between people, economic vibrance, and societal well-being, right? And just a place where myself in the context of the question too. So the work that we do in the Immigrant Employment Councils is, we have a confusing name. It looks like we work with immigrants. We don't work with immigrants. What we do is we work with employers and help them be better prepared to receive immigrants in their workplaces and in the workforce. So while there are so many organizations out there that prepare immigrants to go into workplaces through employment services, we kind of do the other part of the equation. And my job, I'm actually employed by the Immigrant Employment Council of BC. I work there as the senior manager for employer networks, so I design and engagements and strategies for building employer networks. But then I'm also the lead of the Immigrant Employment Councils of Canada, which has 11 IECs across Canada, Workforce Collective, one of them. So basically, my part of the equation here is that, or the challenges I see is in the immigration side. I might be preaching to the choir here, and Mike already kind of said most of what we need to say. Immigration is a defining characteristic of Canada. It's the reality of the situation. This is how we're growing. Other than Indigenous peoples on these lands, everyone here is an immigrant. And just to give you a statistics of what happens if immigration if immigration is not a defining character of us, is that 27% of Canada's population would be compromised of people over the age of 65 by 2040. And if you're following the immigration level plan that was just released early this month, it didn't change much than what was released a little bit earlier either, but we are going to be welcoming 465,000 by the end of 2023. In 2024, we're bringing in 1.2% of Canada's current population, which is a huge jump in percentage. And we're going to be stabilizing at receiving 500 new permanent residents a year in 2025 and 2026. And a very big part of the announcement also stated that over 60% of those permanent residents will be coming in through economic class. Now, it's a little bit misguiding to hear that they would be over 60% most of the time. They kind of ranged between 55 to 60 anyways. So Canada has always received mostly economic skilled immigrants, not despite what the mass media narrative might be pushing on, right? We also know that Canada is still one of the most preferred destinations along the world. So really the advantage here is that we have access, and we are at an advantage to attract and retain talent, great talent from all across the globe. We're a preferred destination. People do want to come here regardless of white collar, blue collar, or whatnot. We are a preferred destination. We have a point system in place that is set, but I agree with Mike here that it does need a little bit of tinkering, and then it needs a collective redesign by all of us to be able to make it work a bit better. But it's important to also be really tactful and purposeful about how we're dealing with immigration, because immigration should not just be a part of bringing people and dumping them somewhere. I think we realize that this is not working. We can see that. But the reality is it kind of does still function in a vacuum. The immigration system does not kind of interconnect with everything that we keep talking about. And we are facing some glooming challenges that still remain, and research shows us and evidence shows us that immigrants who have been in Canada for 5 or less years have the highest unemployment rates. That's 11.7. And that's compared to a 5% for Canadian born. And the highest, they're facing also the highest in precarious employment, right? And it's not stable. And so it's it's difficult to be able to kind of really keep inviting, or not keep inviting, keep that advantage of actually attracting that talent to Canada. We keep getting, every single year the government comes out and says, oh, we're the highest destination, popular destination. But, I sit back sometimes and wonder, when is that going to go away? Because if you're on TikTok, you'll see a lot of things that are not saying the same, right? Anyhow, back to the unemployment rates. I talked about 11.7% unemployment, but that's just a very generic number. That becomes even worse for women and for disadvantaged group, other disadvantaged groups that are new to the country. If I actually I worked on a study 2 years ago, and it was unemployment rate for Arab women, for example, who are new to Canada, is over 17%. So it's a striking number. But then the Institute of Canadian Citizenship as well, they did a study recently, and it's been all over the news. I don't know if you followed it. But there's a concern in the decline of immigrants are coming, but they're leaving, right? There's a 40% decline in citizenship uptake over the last 20 years. And people are leaving Canada. They're not waiting for getting their getting their Canadian citizenship. It's not becoming the place that they thought they were coming to. And so for me, there's a perplexing disconnect between how we keep hearing employers say, we can't find people, and then a lot of immigrants that are coming in and saying, we can't find jobs, right? And that's a place where our organizations and our Immigrant Employment Councils of Canada, we're trying to kind of untangle there or sort.
Great, thanks, Rania. So we've got Pam with the not-for-profits looking at that third place, right? You've got home as first place, third place, and then you're really focusing on that second place of work, and how can that second place also be a sticky factor to keep people here and make sure that they stay and are happy and support them. Awesome, thanks, Rania. Fiona.
Good morning, everyone. And so I'm representing Niagara Health. So a couple different perspectives that we look at healthcare as an economic component of economic infrastructure is when you look at a community, often a community is designed for people to live, learn, work, and play. And so some of you might recognize that term. That was something we talked a lot about in public health and municipal and regional government. And so by show of hands here, who would pick a community to live in based on healthcare? Okay, so there's some of you who would, but I think Mike's comment is if you're looking at having your 30 years old or 30 months old, you'll want to have access to a primary care physician, which in Niagara has a significant shortage, but you'll also want to have access to healthcare when you're older. So I think about the concept of the gray tsunami. I can talk about that because now I have gray hair. But often when we think about people coming to our community, healthcare can be a significant factor in their decision of where they're going to live. And I'll give an example is if you look at Halifax, Halifax, Mike spoke of how there's been that growth. Often when I speak to people who are older, the concept of relocating to Eastern Canada is very attractive. However, they're concerned about access to healthcare, that they may not have the same healthcare infrastructure that you would have in Ontario. So as an important contributor to economic infrastructure, healthcare is a driver. The other piece is healthcare is a massive employer in the province. And particularly in Niagara, we talk of 7,300 people. These are nurses, physicians, our volunteers, healthcare aides, environmental services workers, your finance folks, your HR folks. So it's a large employer. And really what we want to do is create an environment where people can do their best work, that they can feel supported and cared for so that they can deliver the best patient experience. But they also have bills to pay. They have responsibilities, financial, personal responsibilities. So how can we be an employer that pays appropriately, pays to market, and really helps to recruit and retain? And with that said, we have had the tremendous benefit of engaging more with internationally educated healthcare professionals. And we have seen how bringing in internationally educated health professionals has helped us on many levels. One is it's diversified our workforce. The other is these are individuals who may come from another province, country, who are going to bring what are some leading practices that we can also implement in our work environments. And then lastly, the economic infrastructure is how many people here are in a community where there's a new hospital that has been recently built or is in the process of being built? Okay, hopefully people in Niagara are like, yep, there's a new hospital being built. And does anyone recall the St. Catharines Hospital site when it was going up about 10 years ago? Yep, and yep, some of you were actually part of making decisions about where things would go in that facility. And if you look at that space, what was farmland is now completely built up. And has anyone recently driven by the new South Niagara site? Okay, your car is going to get incredibly dirty because everything is being turned over. And huge thanks to the City of Niagara Falls for the amazing infrastructure work. When you drive in that space in about 10 years, you will see a massive change in that physical location. There'll be gas stations, restaurants, and all those pieces. One of the things, plant a seed, is we would love to have a child care center right next door. And you know, I love the comment when Mike said this morning is, often when we ask our team members, what is it you need from your employer? Often we hear, I would love to have child care on site. Being a 24/7 environment is very challenging for childcare. And so if anybody can help influence that, looking over there, please do. But when we start to think of, you know, the necessary supports, and really it's that goes back to that concept of live, learn, work, and play, and how can we help contribute to that thinking and that culture.
Amazing, Fiona. Thank you. And it's so interesting you say that. My neighbors actually left the GTA and moved to the city of St. Thomas because of the proximity to healthcare in London. So, and they had retired. So they were really looking for that healthcare support for sure. So, great. Thank you. So second question, what does cultivating healthy HR practices and workplace culture look like in your perspective? So how do we support those people in our environments? So Rania, we'll start off with you.
Okay, I think that's a question that kind of is always on our mind at the Immigrant Employment Councils. And I think one of the things, I don't know how many of you are more familiar now with what an intercultural competence framework is and how many of you actually use it to build your HR practices. There's so many words that are being thrown at us. First, it was emotional intelligence, then it was intercultural intelligence and whatnot. But I think that given how we started talking about how immigration is going to be, or is a key defining characteristic of us, is intercultural intelligence is a must. It's something that kind of needs to be the core of your HR strategy. And intercultural intelligence, if you're not very familiar with it, it's just basically being able to be your preparedness to deal with multiple viewpoints, multiple approaches, multiple ways of work, and what is acceptable and not to different team members. This is where we see immigrants, or newcomer immigrants in particular, fail very quickly in workplaces, or employers that are not really willing to invite newcomers into their workplaces, is because, you know, at an interview, they'd be like, oh, I didn't like the way they presented themselves, or the way they answered this or that or whatnot. But no one ever told that immigrant what it's supposed to be like. And not just they didn't tell them, telling is one thing, but actually being part of I don't know, finding our new cultural identity as a society, because it will keep on changing. Like it's, was really glad to hear this morning the whole point of like this whole demographic shift. Maybe we should just accept it and start working with how we're actually going to, how does it look like? So you're going to need to start designing your HR practices to be able to reflect, and it first comes with accepting that I need to make a conscious, mindful, and purposeful approach to how can I work with people who are different than me, and not because I need to be tolerant, but because I need to use that diversity to my strength. One of the things that I think is So there's a lot of learning, but there's a lot of unlearning to do in HR practices these days. And one of them, for example, in the immigrant space is that I find that a lot of people deal with the having to hire someone who's an immigrant, and most of them are equity-deserving groups that are defined as disadvantaged groups or whatnot. It's a charity case, but it's not a charity case. These people come here purposefully, coming to Canada, wanting to work, wanting to contribute. They're not a charity. You could do something with them. And most of the time, we don't use that diversity to our advantage as employers.